The surprising link between weight changes and COPD risk, uncovering the impact of early adulthood BMI. In the quest to understand the complex relationship between body weight and chronic obstructive pulmonary disease, COPD, a recent study has shed light on some intriguing findings. While we often associate COPD with smoking, this research highlights the role of weight changes and BMI during early adulthood in influencing COPD risk later in life. But here's where it gets controversial. The impact differs between men and women, and it's not always straightforward. The study, conducted by a team of researchers from China and the UK, analyzed data from the China Kadoorie Biobank, a large-scale cohort study. They focused on adults aged 35 to 70, tracking their weight changes and BMI from early adulthood to middle age. Over an average follow-up period of 11.9 years, they monitored the incidence of COPD and its association with weight and BMI. For men, the findings were quite surprising. Weight change and early adulthood BMI were inversely linked to COPD risk. In simpler terms, men who maintained a stable weight or had a lower BMI in their early adulthood had a reduced risk of developing COPD later on. However, there was a catch: early adulthood obesity, BMI greater than or equal to 28.0 kilograms per square meter, was associated with an increased risk of COPD, especially among non-current smokers. So, while a lower BMI is generally beneficial, obesity during early adulthood can be a red flag. Now, let's talk about women. Here, the story takes an interesting turn. Extreme weight loss and gain were both associated with an increased risk of COPD in women. Moreover, the effects of weight loss and gain on COPD risk were more pronounced in women who were underweight or obese during early adulthood. This suggests that weight fluctuations can have a significant impact on respiratory health, especially for those already at a higher risk due to their early adulthood BMI. But why the difference between men and women? The researchers speculate that it could be due to variations in body composition, hormonal factors, or even differences in smoking behavior. After all, smoking is a major risk factor for COPD, and the study did find that the impact of early adulthood obesity on COPD risk was more pronounced in non-smokers. So, what does this mean for public health policies and individual lifestyle choices? The study's authors emphasize the need for targeted interventions to prevent excessive weight gain, especially during early adulthood. They also highlight the importance of considering both weight changes and BMI when assessing COPD risk. And this is the part most people miss. While obesity is a well-known risk factor for various health issues, this study shows that even extreme weight loss can have negative consequences. It's a delicate balance, and maintaining a healthy weight throughout adulthood is key. But here's the million-dollar question: should we be more concerned about weight gain or weight loss when it comes to COPD risk? And how can we strike the right balance between a healthy weight and a healthy respiratory system? These are the questions that need further exploration and discussion. So, what do you think? Are you surprised by these findings? Do they challenge your understanding of the relationship between weight and respiratory health? Share your thoughts in the comments below.